behalf of Region 7 and the Ask for Respect Supplemental Grant, we want to welcome you to our series of interviews focusing on the perils and pearls of lessons learned regarding COVID-19. Our hope is to share the lessons our colleagues have learned and to assist you with your healthcare journey during this pandemic. Thank you for listening.
All right. Hi, everyone. I'm Angie Vasha. I am the Director of Isolation and Quarantine Services here at Nebraska Medicine. And I'm really excited to have Sarah Cantor join us today for a conversation on how to travel safely during the age of COVID-19. Sarah, would you introduce yourself and give our guests a little bit of background on yourself?
Sure. I am Sarah Cantor, and I'm the president of Those Who Wonder Travel Agency based out of Lincoln. I've been running the travel company for about 4 years now, and the last year during COVID has certainly been a challenge, and we've learned a whole lot in the tourism industry about travel during COVID. So I'm excited to be here. I think this is a great conversation to have today.
Excellent. Thanks. So I wanted to ask, when you think about all of the things that you've learned over the last year specifically, but then even in the 3 years prior to that, what would it be your top 3 pieces of advice for people that are wanting to get back out and travel now that we've seen kind of changing regulations and, increased restrictions on different types of places, but just wondering in general, what would be your top 3 pieces of advice that you want people to keep in mind as they start to think about traveling?
I think the 3 most important things right now with travel are patience, because things aren't like they were 2 years ago. If you're taking a trip, you are still traveling during COVID. So you need to pack your patience. You need to be flexible because things are a little bit different than they used to be, and things may not go the same way. So make sure you're flexible in your travels, and then don't forget to pack your mask, because they are required on all airlines and in public spaces and resorts. So.
Yeah, I have to tell you, I did recently embark on a trip with my son and my sister and her family, and I was really impressed by the diligence of the flight attendants and the airline industry, and how direct they were with passengers, both as we were boarding and as we were deplaning, and even during the flight. And so I wonder if you working, trying to coordinate all of these trips for other folks and doing travel yourself, if you've seen a change in the airline industry, or if there's guidance that you would give people just to be aware of around the new restrictions or the requirements that airlines have regarding, as you said, masking on flights and the federal regulations.
Yes. So the first flight I took post-COVID was in July of 2020. So kind of like right when things maybe started to open up a little bit, albeit prematurely. And masks back then were not widely accepted. And that was right when airlines kind of implemented the masks on airlines were mandatory. And I could see at that time that that the flight attendants they were struggling to get people to wear them on flights and airports. Most people weren't wearing them. And then my last flight was in January. And by then masks were widely accepted. They are highly enforced on the airplanes. You do not take them off unless you're eating or drinking. Most people, I think, tend to get that now, and they know that if they're going to fly, they go in with the understanding that I'm wearing this mask for however long I'm on this plane and until I get to my destination. And it's kind of become more of a social norm, which is great. And we'll see how that kind of plays out in the future. But for now, if you're going to fly, you take your mask and you expect to wear it the whole time.
Great point. So working in the travel industry, have you seen that the implementation of requirements for negative testing has deterred people from traveling internationally? Or do you think that if they continue to consider implementation of negative tests for domestic travel, that would encourage or discourage people from going on trips? Just curious as what you've heard from folks who are considering it.
When that rule was first announced in January, I thought for sure it would be a huge deterrent for people because, having that risk of traveling in destination and not being able to get home, that's a problem for a lot of people. But we've actually seen the opposite. Our bookings for travel have increased exponentially since, the beginning of February, and people are ready to go. I don't know if it's just a renewed sense in travel because they know the people are traveling with are testing negative too, or they're just ready to go somewhere. I'm not sure. But I do think that the testing has actually had a positive impact, at least for my agency. It's been so well worked out within the different countries that people are traveling to. The resorts are so well set up for testing on site that it hasn't we haven't had any issues, thankfully. And for domestic testing, I don't see that necessarily becoming a thing unless COVID spikes again. But when I say that, never say never, because we've been thrown so many things over the last year that we never would have expected. And if it happens, we'll handle it. I think people roll with the punches and people want to travel, so they'll do what they have to do.
Yeah, that's a great point. So when we think about where people should look for travel guidance, so whether we'll ask the first question, assuming that folks are booking their independent travel, they're not going through an agency, where would you recommend that people look for the most up-to-date guidance? And then I think my follow-up question is, if you talk a little bit about, what is the role of a travel agent and how does that help you get to and from a destination more seamlessly or with less risk of complicating factors disrupting your travel?
I think if people are going to book their own travel and not use a travel agent, they really need to pay attention to the CDC guidelines for travel. Their website's updated pretty regularly with what is expected of international travelers and domestic travelers. And then if you're going to travel internationally, the State Department website is always a good resource as well for different travel warnings and whatnot. That said, the benefit of using a travel agent is this is all we do. I spend my days, and I've spent them for the last 14 months, learning about travel restrictions and regulations and learning about different countries' requirements that change all the time. So you may book your trip yesterday and you may be up to date on what the current CDC guidelines were yesterday, but that could change 10 days from now. And unless you're using an agent or unless you're really diligent about following those yourself, you're not going to know what's going on. And that's literally all we do right now is follow CDC guidelines and State Department regulations and different countries' requirements.
Great. And so thinking about all of the research that you're doing on a regular basis, if we start to think about the typical destinations that people want to travel to, especially during the cold months or as summer starts to blossom and people really just get a little bit stir crazy, what destinations do you think would be on your higher list of safe options for folks to travel to, whether it's because of COVID case counts or just ease of travel to and from? And just if you could talk a little bit about the types of trips that you would advise people to take. And I know it's very individualized based on their risk tolerance or the things they like to do, but just curious if you have kind of a short list of places that you would recommend folks consider going to.
Sure. So I think the best places to travel to right now are the destinations that have COVID restrictions in place. So there's all kinds of options. People can pretty much go anywhere. But me personally, I will not travel to a destination that doesn't have some sort of COVID protocols in place. So that said, I recently went to Las Vegas. They were very strict on their mask mandates. They were very strict on their social distancing when gambling. I was really surprised, honestly, because I think a lot of domestic travel doesn't have necessarily those restrictions. Also, I've been to Mexico 4 times since COVID has come into our lives. And the resorts, they're at a limited capacity. All the staff are very diligent with masks. I know it's the same in most Caribbean islands. A lot of the islands require testing to even enter, which is a benefit, I think, because you're not necessarily carrying COVID in with you. So for me, we look at when I have somebody come to me and they are really concerned about safety protocols in place, we can go over, what are the different regulations on the different islands, what's required of you if you want to go to this destination. Are you going to have to wear a mask? Are you not going to have to wear a mask? So we just kind of talk about that. And so for me, for me personally, it's the safest places are the ones that have the COVID protocols in place right now.
So I think it's interesting that the top 3 pieces of advice that you noted were packing your patience. And when we think about, the implementation of COVID restrictions, Omaha and Lincoln, at least currently as of today, do have mask mandates in place, but the majority of the rest of the state does not. Mm-hmm. And I have to say that recently traveling, outside of the continental US to Puerto Rico, I was very impressed by the level of restrictions that they had in place, but it does put a different spin on the places that you can go, having to be prepared. The restaurants were still at 30% capacity. Mm-hmm. And so, a lot of pre-planning of trying to get dinner reservations. You can't just walk up to somewhere. So wondering if you could talk a little bit about when you traveled to Mexico, if you were off the resorts and if you noticed those same types of just different things that you have to consider if you're traveling to places with COVID restrictions in place. And Just kind of if you could talk a little bit about what your experiences have been.
Sure. So I think that is where I say patience and flexibility are so important right now, because resorts cut all their staff. So, and they're slowly building them back up. But in the meantime, restaurants aren't open at full capacity, if at all. Oftentimes they're rotating them at resorts. So maybe a resort that normally has 10 restaurants now only has 3. And so reservations are key at most places, whether you're off the resort or on the resort. I am one, when I travel, I like to go off and explore whatever city we're in. So we did go off the resorts, I think every time we went to Mexico, and we're able to dine in. We use reservation apps, which I recommend to all my clients. OpenTable and Resy are great to find reservations on all destinations, wherever you are. You have to plan ahead. It's not necessarily like before where you could just jump on a plane and everything's going to work out. I mean, you certainly can do that, but you may be ordering room service, which is also not that bad. But I mean, you just got to know what you're kind of getting into when you travel these days.
Yeah, I think one other thing that really stuck out to me is just that, you know, as you're thinking about traveling, like the air handling on airplanes, you know, they have really good airflow. They're having people wear masks, but it's still the airport that I think is where you're going to run into your biggest risk for folks gathering together, you know, taking masks down for extended periods of time. And so thinking through what folks can think about when they're traveling is, you know, maintaining your nuclear group together. Not cohabitating in a large open area food court where lots of people are unmasked and people aren't necessarily policing the area. And so I think that you're right that a lot of folks are ready to get out there and travel. And I think it's particularly important to keep in mind that you want to maintain your kind of bubble of safety, so to speak, as you're going through those public spaces, especially crowded areas like airports and the waiting areas. So I don't know if you have any tips for success or safety as you think about traveling through crowded airports or rushing through connecting flights.
I mean, I think one thing that I've always told people when they travel is bring your own food. Because one, if your connection is short or your flight's delayed, you may not have a chance to stop and get food anyway. But now, especially these days where there's long lines and people are so close to each other, if you have your own snacks in your bag, you don't necessarily have to worry about, you know, standing in line with a bunch of people, and you can kind of be off on your own a little bit. The gates tend to get really crowded. So maybe if you can find your own spot away from that and just wait for your flight to be called, is a benefit. I think for us traveling as much as we have, since this is all, you know, affected our lives so much, it's just interesting to kind of see how most people adapt, but there's a few people that don't, and they don't care about social distancing or masks. And so just trying to avoid, you know, those people who are, you know, loudly talking on their phone with their mask off in the middle of the airport is probably not somebody you want to spend a lot of time around, because if they're doing it in the airport, they probably live that way outside of their travel life too.
Yeah, that's a great point. You know, just being aware of your surroundings as you're walking through the public spaces.
Yes.
So I want to talk a little bit about the tourism industry. And so thinking about just the overarching financial impact that COVID has had on multiple industries, I wonder if you could talk a little bit about just what you've seen, and if you're seeing any signs of recovery across the industry now that things are starting to open up a little bit.
I do think the financial impact is massive and it's worldwide. So I think a lot of people don't understand that tourism is 10% of the world's economy, which is significant, especially when it's been completely shut down for over a year now. I mean, most parts of the world, they're not even moving as much as the US is right now. We are starting to see an uptick in travel in the US, which is great. But it's going to take a long, long time to get back to where we were. Some studies I've read said it's not going to be back to normal until 2023 or 2024. And I think even that may be a little bit too positive. I mean, our cruise ship industry is still shut down, and that's like an entire industry in and of itself. Most resorts are limited capacity due to government regulations, which is to keep people safe, and that's great. I think the important thing is if people want to travel, it's so important that if you're going to do it, you travel safely so that we can keep these destinations open, so that we can keep the planes in the air. We're not free of COVID yet. It's not gone. And until it is, we really just need to be diligent and mindful, so that we can help support the tourism industry that is struggling so badly.
Absolutely. That's a great point. So thinking about that, when we're talking about like the benefits of going through a travel agency or a travel agent in particular, can you talk a little bit about why would people pick a travel agent? What do you guys do? I think a lot of people don't really understand the role that the travel agent plays, or kind of how that helps you travel safely, especially right now.
So I think the one positive thing that's come out of COVID for travel agents is the resurgence of the importance of a travel agent. I think that most people thought this was a dead profession, which it's very much not, but we've kind of taken front and center during this crisis. One thing that's really beneficial about using a travel agent is we study all the rules and regulations. We know what's going on in all the countries that we book travel to. We have in-country partners. So I have contacts in Jamaica, I have contacts in Mexico, I have contacts in St. Lucia, and we're constantly communicating about what's going on. So that's a benefit. The travel agent community as a whole is phenomenal in that we all communicate with each other. So we really are more of a community over competition business to help support the tourism industry. And so that is benefit. I'm talking to travel agents every single day about what we need to do, what's good, what's bad, what we need to change. So I don't know if that answers your question, but I think that, if you use a travel agent, you're using somebody that has your back. I mean, we've mostly worked for free for the last year, but we're still working 40, 60 hours a week because we love what we do and we love our clients. And we're going to continue to do so until things are back to normal.
That's great. So I think one of the biggest questions that people have is what happens if I book my flight and I can't go? Right now, I think a lot of the airlines have no change fees. They have a lot more flexibility than they used to. But there are still quite a bit of restrictions. And so how do you advise for people to be aware, like be buyer beware, I guess. And so when you're thinking about booking flights, where is the best place to find the specific rules or regulations related to individual tickets? And then how does a travel agent help you navigate either getting your money back, rebooking a flight, or making sure that you're getting to your next destination in an effective way?
Sure. So the small print on airline tickets is always fun to read through. I think one thing that we've learned over the last year is how to book travel in a way that is flexible, how to book travel in a way that protects you and your money, because that's all changed over the last year. Different insurance policies didn't cover COVID, now they do, but only certain things. And so most airlines are waiving change fees, and I certainly hope that continues because that's a win for everybody. But when it comes to your hotel, that they may have fees that you have to pay if you don't show up on time or whatever. So when we book travel, we do it with certain policies that make sure that you're protected. If people want to book travel on their own, I would just encourage them to really consider a travel insurance policy that's going to cover them for any reason if they have to cancel. Because COVID isn't covered under certain things, but it is covered under if you have a cancel for any reason policy.
That's good to know, because I think there's a lot that you're trying to go through and navigate, like, what do I buy? What don't I buy? What's worth investing in? And really the price of travel insurance is not cost prohibitive in most cases. So I think it's interesting to think about. It's not something that you routinely buy, but a good piece of advice in traveling during the pandemic.
Yes. Yeah, I always tell my clients 9 times out of 10, you're not going to use that travel insurance policy, but that one time you use it, you're going to be so thankful you had it because it covers things like delayed flights, trip interruption, your baggage are lost. If you need a medical evacuation, which is very, very expensive, that stuff's covered by travel insurance. And those are things I don't think most people think about.
That's a great point. So I want to ask, just in general, if there's, as you think about all of the challenges that you've encountered, if there are things that you would want our listeners to really consider as we kind of close out the Zoomcast that we have here, just thinking about what would be your final parting words of wisdom, I guess, for folks that are starting to think about traveling in the coming weeks or months.
I think educate yourselves on the destination that you're going to, respect their rules and that they expect from their guests when they travel. Be diligent about safety protocols. It's so important to keep us open and keep us running. Support the industry in whatever way you can, I think is important. Obviously I'm going to say use a travel agent, but that's, a personal decision. There's a lot of great travel agents in Omaha, Lincoln, Grand Island area that are ready to help you. I think just being respectful is the number one thing. Being respectful of your fellow citizens when you're traveling is so important, and the destination that you're going to and what they expect from you.
That's great advice. All right. So, Sarah, I think one follow-up question that I have is when we think about folks traveling to another destination, we talked a little bit about having to get tested to go. Can you talk a little bit about what places you're required to test to come back to the United States? I know you said that a lot of resorts have that as an on-resort option, but just a little bit about the changing landscape of how many locations are required, how many locations that you go to are required to test before you can come back, or vice versa.
So testing is required for any international destination to come home. So if you're in Mexico, Caribbean, Italy, Brazil, not that they're open, but if they were, you would have to test to come back home within 72 hours of boarding your flight. So anybody that we send on vacation, we make sure that there's on-site COVID testing for them to come home. However, if you go to, say, Puerto Rico, U.S. Virgin Islands, Hawaii, all U.S. territories or states, those do not have requirements to come home, but they do have tests to leave. So it just depends on the destination, and it's what keeps us on our toes because those things are changing all the time. There's most of the islands in the Caribbean, you test to go there, you test to come home. So it really is destination specific.
And I think that there's a lot of confusion around what tests are accepted. And so I think that this is where having a travel agent or somebody that can help guide you, because not all tests are created equal. So I wonder if you could talk a little bit about how that has changed as we've seen additional rapid tests come out. And if you would give people some advice on how best to figure out what tests are going to work for the destination you're going to.
So to come home from any international destination, you can do the rapid test, which is nice because most people have it back within a couple hours. But for most of the Caribbean islands and Hawaii, you have to do a PCR test. There are some, I think, exceptions to the Hawaiian test that you can do some sort of rapid test, and that's new. So I'm not specific on that quite yet. I have my first Hawaii clients leaving in 3 weeks, and we'll have it figured out by then. But for most of the time when you leave the United States, you do have to have that PCR test that can take, 72 hours to get back. And sometimes you have to have it within 72 hours of your flight. So
yeah, that's a big logistical consideration for where people are considering going. And do you have access to testing locations near enough to you that can guarantee your results back in time? Because I think for most of the places you have to do a travel declaration and upload those test results before you can enter into the place that you're going. So yes. I think that the timing of the testing for the PCR based test is a huge consideration.
It is a huge consideration. And we've had people that haven't got their test back in time and they've had to cancel within, 24 hours of their flight. So that's why, again, it's important to book flexibly so that you get your money back if you don't get your test back in time.
Yeah. So I think one follow-up question, I know you said that you guys have not had a lot of complications from folks not being able to get back home, but do you have any insight on if say you go to the Caribbean or you go to Mexico and you do test positive for in-country support, are you allowed to just stay at the resort that you're at, or are there considerations for how they would require you to isolate if you turn positive while you're there?
So most resorts actually are offering either a complimentary quarantine period or a reduced nightly rate quarantine period. They have it kind of their own section of the resort where they move you to the quarantine section. And most of them are offering it complimentary at least through the end of this month. And we're yet to see if that is extended through March 31st. But there have been people that have tested positive that I know of in destination, and they've stayed there 10 to 14 days. They've been cleared by a doctor to travel, and they've all made it home after that time. So it's minimal, but it does happen.
That's great. So I think something else for folks to keep in mind is, can you add an additional, 10 to 14 days onto your vacation time if you happen to be stuck in another country and are not allowed to come back to the United States?
100%.
And I think when we think about travel insurance and individual healthcare insurance, something for people to keep in mind is if you get sick while you're out of country, what are your medical coverages for, out of country care? And what does that look like for, receiving care, especially if you're somebody with underlying health conditions or chronic health conditions where you might require a higher level of care. So I think, for people to keep in mind the level of risk that you're willing to accept when you travel, and being cognizant of what type of care that you require at baseline for ongoing medications, refills, things like that.
Sure. So my advice to anybody traveling right now that's on a prescription medication is take 3 weeks worth of medication when you go on vacation, if you have it. That way you don't have to worry about that in destination, because what may be available in Jamaica may not be the same thing you can get at your local Walgreens. So that would be my first piece of advice to anybody traveling right now. The second piece is to buy that travel insurance, because if there are medical needs that need to be paid for, the insurance company has got you covered. Whereas not necessarily all domestic health insurance plans will cover you when you're traveling internationally. It's something you can call your health insurance company and ask about, and they'll give you specifics on, but most of them are limited in scope, and it's always a payback structure. So you have to pay for everything up front.
It's a great points. I think those are really all the questions that I have. I think this is great conversation, and I think that it does kind of lend a lot of consideration for what folks should be thinking about, not only traveling during COVID, but in non-COVID times, because a lot of these medical conditions or medical emergencies can happen at any time. I think just, the risk of a communicable illness adds a layer on top of that, that we just need to continue to be cognizant of.
Yes, for sure. I mean, we've learned a lot from this, and we can only go up from here. So.
Well, Sarah, thank you very much for joining us. I think, this is a hot topic that people are really interested in. As you know, we're all getting a little bit stir crazy. We want to make sure that we can travel safely, and make sure that we keep travel as an option as we come into the summer months. So yes. I really appreciate your perspective and taking the time to chat with us today.